Hey everyone, and welcome to another info session. My name is Steve, and I'm an accredited exercise physiologist and exercise scientist. And today I'll be bringing to you the benefits of physical activity and specifically how it relates to cardiovascular type training. So, what am I actually going to be talking about throughout the slides? So, of course, what actually is cardiovascular training? What are the health benefits that we see from cardio training, and how do we build our own cardio training program at home? And finishing off with some recovery tips. So why don't we get into it? What actually is cardio training? So cardio training is essentially just physical conditioning that exercises your heart, lungs, and blood vessels. So any exercise that works your heart, lungs, and blood vessels, essentially. But this particular exercise has to be something that elevates your heart rate from that resting heart rate that you have for a prolonged amount of time. This time is roughly 10 minutes. Essentially, the evidence suggests that you want at least 10 minutes of any form of physical activity to start seeing any form of health benefits. So that's where we say 10 minutes at least of training is beneficial. You know, if you get up out of your chair just for a second, that's not going to do a whole lot. We're not going to adapt from that. Next part, cardio training can be categorized into two different forms of training. So this is where we have continuous training or high intensity interval training. And you may have heard of this as HIIT training, but I will outline a little bit as to what these are in some later slides. So this brings us to what actually are the health benefits of cardiovascular training. So health benefits, of course, we do get an improvement in that heart function, okay? So what do I mean by that? We get an increase in the volume of our heart. So our heart literally does increase, or at least the space that holds blood in it does increase in size. And as a result of that, I beg your pardon, we can see a reduction in the heart rate, okay? So if your heart can grow a little bit bigger and therefore pump more blood into your body per beat, what we get is a reduction in that heart rate. And as such, your heart doesn't have to work as hard for any form of exercise throughout the rest of the day. Additionally, there's actually also pretty significant research or conclusive research, I should say, that suggests that we have a reduction in our risk of arrhythmias. So an arrhythmia essentially is just a not so normal heartbeat, okay? So it's where your heartbeat doesn't just beat normally. It's something where it kind of quivers and maybe stops and then does something like that again. You may have heard of this as AF or atrial fibrillation. So exercise reduces our risk of those events. Next, we can see a reduction in blood pressure. So why do we actually get a reduction in blood pressure? Well, simply cardiovascular training increases the production of nitric oxide in the bloodstream. So nitric oxide is that chemical that essentially just makes your blood vessels grow larger in diameter. And if it grows larger in diameter, it can therefore reduce the amount of pressure inside the blood, okay? This is where we can think of, say, wine. You know, why is wine healthy? You know, one glass of wine healthy throughout a night? It's because it actually has some of this nitric oxide, which opens up your blood vessels a little bit. So that's one benefit. Of course, we see a reduction in LDL cholesterol. Now, this is the bad cholesterol. So with that, we get less plaque in the bloodstream, which prevents a narrowing of our blood vessels, which therefore reduces the pressure. The last part here is we can see a reduction in arterial stiffness. So how stiff actually is, how stiff are your arteries? With exercise, it starts to become a bit more lax, like you can actually expand a little bit better. Whereas in the early stages, it might not be able to open up as much. So therefore, the blood pressure increases. The next part, we get a significantly reduced risk of type 2 diabetes. Why do we get that? Because we can see an improvement in insulin sensitivity, okay? So our body's ability to react to insulin, which is that hormone that takes glucose or sugar out of the bloodstream and pulls it into the muscles, okay? So our body responds better to insulin, lower blood sugar. Additionally, improved glycemic control. So if we're exercising, we're actually using glycogen or the sugar in your blood. So therefore, that's also going to be reduced. The next part, exercise can reduce your body fat. And with a reduction in body fat, we can see a reduction in inflammation in the body. And with inflammation, we get a reduction in insulin sensitivity. So if we reduce body fat, we therefore reduce inflammation and therefore increase insulin sensitivity. So I know that's a lot to wrap your head around, but that's how our risk of type 2 diabetes reduces. Next part, these ones are actually quite meaningful here, and I'll talk to you especially about the risk of cancer in a moment, but a significant reduction in your risk of stroke. And I'm using the word significant a lot, but the research shows that it is really potent in this. So that's why I'm using it quite a fair bit. So why do we see a reduction in stroke? As I mentioned, we see a reduction in blood pressure. Okay, so if we have a reduction in blood pressure, we therefore have a reduced risk of our blood vessels rupturing in our head. Additionally, if we see a reduction in that stiffness, we can also again reduce that blood pressure and prevent any rupturing of your blood vessels again. Next part, a reduction in your risk of ischemia. So what actually is ischemia? Ischemia is a blockage, a loss of oxygen in your brain, essentially. So if we have less LDL cholesterol in our bloodstream, we therefore have less plaque that's built up. And if we have less plaque, we therefore have a lower risk of blockages. And essentially, we have a reduction in risk in ischemia. A significant reduction in risk of cancer. Now, this is actually my favorite field of exercise. For some of you that might know me, I have worked a little bit. I've done some research on the effect of exercise in men with prostate cancer. So this area is really close to my heart. So we probably understand that exercise reduces cancer, but I guess a lot of people might be thinking, well, why actually is that the case? So I have a few dot points here, and believe me, there are so many more, but these are the most important ones. So we have improvement in insulin sensitivity, which I did touch on before. If we can improve that insulin sensitivity, we therefore have less sugar in the bloodstream, okay? And sometimes when you have more sugar in the bloodstream, your cells can react to that excess sugar and start to form multiple more cells and cause a tumor, essentially. They proliferate. So more insulin, or I beg your pardon, an improvement in insulin sensitivity reduces what will cause the cancer to begin in the first place. A reduction in chronic inflammation, same thing. These little biomarkers in your bloodstream that suggest you have chronic inflammation reduce, but those biomarkers also increase your risk of cancer. Additionally, increased antioxidant capacity. Okay, so what actually is an oxidant in your bloodstream? Essentially, these oxidants are just molecules that cause cells in your body to get damaged, and the DNA changes a little bit, which can cause it to proliferate again. So if we have more antioxidants, we have a reduction in these cells that change the other cells. Better immune function, okay? So it's actually quite well known now that these other cells in your body called natural killer cells will find these damaged cells that will start to proliferate a lot and will kill them, essentially. So now we don't have this proliferation. So if we're more fit, we have better immune function and more natural killer cells. So therefore a reduction in the risk of cancer. Lastly, and this is really important too, we have improvement in actual DNA repair, okay? So as I mentioned, your DNAs in your cells will cause your cells to either keep growing or never die, or at least, increase the lifespan of the cell, okay? So our body can now realize that there is there's damage in the DNA, and apoptosis means cell death. So your body will actually realize it and kill the cell. So that's so important. Next part, we have a protection against cognitive decline, okay? So this is that kind of mental health a little bit. And these are conditions such as Alzheimer's or dementia. With an increased amount of physical activity, we see there's an increase in neurotropic factors in the brain. Okay, so what is a neurotropic factor? A neurotropic factor is essentially a protein that promotes or that allows for nerve growth. So this is where we see a reduction in that death in the brain itself. And we can actually think more clearly, and our memory lasts a lot longer. So we get a protective effect of exercise, which is so important. So we see the health benefits. Now we kind of get to how do we actually train how do we write our training programs? And this is where you'll see the difference between moderate continuous training versus high intensity interval training. Okay, so there's a lot to take in on this slide, but I'll walk you all through it. So moderate continuous training, what actually is that? That is that type of exercise where you have that one sustained speed, okay? So you're just going that one speed throughout the whole session. It's that moderate intensity, okay? So you're at about a 5 to a 7 out of 10. It's not too hard. It's not the easiest thing in the world, but you're working. Next part, we can see that you can use either distance or time to guide the length of your workout. Normally, when you begin running for the first time, you would start at about 20 to 30 minutes in that week one. From there, you would then start to increase the distance or the time that you run by about 10% every 1 to 2 weeks, okay? It depends on how you're feeling from that particular program. I would be suggesting that you start at just 3 runs per week, and then eventually you can actually increase that to about 6 runs per week. Unlike resistance training, your body does recover a little bit better to just regular running. So I do have an example as to what does that actually look like. So week one, let's just say we want to go for a 25-minute run. It's nothing too crazy. 25 minutes might look like 3 kilometers for you. It could look like more, it could look like less, roughly 3 kilometers at about a 6 out of 10, okay? Pretty simple. The next week, you'll increase that by about 10%. It's a little bit less than 10%, but that's still completely fine. 27 minutes. Or you can see 3.3 kilometers. Still, same intensity, a 6 out of 10, not too hard. But I do have another example here that you can also choose to just run for 20 minutes, but at 3Ks as well. So what that means is your intensity is a little bit higher. So we're now working about a 7 out of 10, okay? The time is less, but the distance is the same. It still works out to be the same thing. Now you can do this particular run, the 25-minute run, or the 20-minute run in the same week. There's nothing stopping you from doing that. Next, high intensity interval training. So what actually is that? This is where we have 2 alternating speeds, where we have our working capacity or working run, which is at a high intensity. So like a 7 to a 9 out of 10. A 10 out of 10 is a maximal sprint, okay? So we are not actually sprinting, we're going a little bit below that. Our rest, so you can either do like a little light jog or you can actually stand still. This is where we have a low to a moderate intensity. It's kind of like a bit of a recovery, a 0 to a 4 out of 10, okay? We are going light here. It's just either a light walk or a light jog. The training intensity is based on that work to rest ratio, okay? What does that even mean? So we have a 1-to-1, a 1-to-2, or a 1-to-3, or a 1-to-4. So what that means is you work for, let's just say 1 minute, and then you rest for 1 minute. Now, if you're working even harder, you'd work for say 1 minute, and then you'd rest for 2 minutes. The harder you work, or here I've got the faster and harder that you run, the longer your rest should be, okay? So if you're working at about that 9 out of 10, that's where you start to have that 1-to-4 rest ratio. Underneath that, start at just 2 sessions per week, okay? And then increase to 5. The reason why this is less than that moderate continuous training is because it is a little bit harder and your body will need a little bit more time to adapt to it. So what is an example of this? This is where we've got a run for 1 minute, which roughly equals about 250 meters. It might, same thing, it might be about 200 for you, or it might even be 300 meters. It depends on your fitness. At just a 7.5 out of 10. So it's still pretty high intensity, but because it's not a 9, you then jog for just 1 minute after, okay? So that's where we have that 1-to-1 rest ratio. It's not super hard, so we can rest for 1 minute. For this, you would then just repeat that for a total of 6 times. After that 6 times, you would then rest for maybe 3 minutes and do a total of 2 sets altogether. So you would just repeat that all together. Another example I have for it is where you would run for 30 seconds, which might equal about 150 meters. And that could start to look more like a 9 out of 10 difficulty. That's really, really getting quite difficult. As such, you would then jog for 1 minute after that. To be honest, you could actually rest for that, I beg your pardon, 1.5 minutes to make that 1-to-3 ratio. But then I've got repeat for 8 times for a total of 2 sets. Now, a big question is one better than the other? Really, the answer is no. It is what you enjoy more. Me personally, I tend to like this high intensity interval training a little bit better. I find that I can work towards something and I'm a little bit more motivated towards it. However, with that moderate continuous training, you might then just want to put a podcast in your earphones or headphones, and then just run to that. So it depends on your goals there, but at the end of the day, you will get the same kind of fitness outcomes with both of them. So don't stress too much about that. Finishing off, we just want to talk a little bit about that recovery. So let's just say we've finished our run, okay? What should we be doing after that? Well, the key is to not just stand still throughout the day. So I would still recommend going for walks, just keeping the blood flow going, doing a yoga class. And I've said here at the bottom, don't just sit still because it hurts. Keep moving to increase the range of motion in your joints and to prevent that stiffness. Next, we have replenish your body, okay? We need to be drinking lots of water. You will be using quite a fair bit of water with these workouts. So replenish your water, eat healthy carbs, okay? So when you're running at these higher intensities, your body actually does use carbohydrates as its main fuel. When you're going lighter intensity, your body tends to use a bit more fat. The harder you work, the more carbs you use. So if you want to keep working at that high intensity, you do need to eat healthy carbs. Whole wheat bread, brown rice, little things like that, oats. Get your protein in. Same thing, your body does need to recover. You might have some slightly damaged muscle, which is completely normal. Have your protein to feel better and recover better, I should say. Finishing off, and I've said this in the resistance training slides, sleep, sleep, sleep. If you don't sleep well enough, your body will not recover and you won't be able to work as hard as before. So make sure you try to get your sleep in and get some strategies in to help with your sleep. Maybe that'll be a topic that we discuss in the future. Now, before I sign off, I do want to specify that if you do have any pre-existing health conditions, I would highly, highly, highly recommend that you speak to your GP, who can clear you for exercise, okay? This information that I provided is just those general guidelines for the average person. These are not specific guidelines for anyone who may have pre-existing health conditions. So please make sure you see your GP with this. With that all being said, I really do hope you enjoyed that session and took some valuable information out of that. If you do have any questions, please feel free to leave it in the comments and I will do my absolute best to answer that to the best of my ability. All right, take care. Bye-bye.